Infantile hemangioma shortly after birth. Cavernous hemangioma is a large vessels hemangioma with cystic dilated lumina with thin walled. ISC factor 8 RA CD31 CD34 for the endothelial cells. Large, the other subtypes, large vessel hemangioma, vessel with the structure of vein, combination of both vein and artery, that is arteriovenous hemangioma. Intramuscular hemangioma, we report due to the location, and one entity is intravascular papillary endothelial hyperplasia, that is Masson lesion. One is, another variety is spindle cell hemangioma, originally described as spindle hemangioendothelioma. It can occur in any age, male preference, and it is found in dermis and subcutaneous tissue. These are the, I think it is not difficult to report a hemangioma or something. So I will skip this one. These are the microscopic features of this hemangioma. The endothelial cells. This is the cavernous hemangioma. See this thick wall, dilated areas. Hemangioendothelioma, yes, it sometimes it is difficult to diagnose hemangioendothelioma. It is a vascular tumor of endothelial cells, and it is between intermediate position between a benign hemangioma and angiosarcoma. Epithelioid hemangioma is a malignant vascular neoplasm. This is somatic soft tissue, lung, liver, or any organ. It is always mostly occurs in the adult. Epithelioid hemangioma is larger than always 10 centimeter, white form. You can see in the microscopy epithelioid endothelial cells, round vesicular nuclei, amended eosinophilic vacuolated cytoplasm with myxohyaline stroma. And ISC, CD34, CD31, and podoplanin positivity. So essential and desirable diagnostic criteria for this epithelioid hemangioendothelioma is cord or nest of epithelioid cell with cytoplasmic vacuolization and myxochondroid hyaline stroma. We can pick up in the next slide. See, this vacuolated cytoplasm, these are the endothelial cells. You can pick up in very well in the good H&E slide, and this is the ISC, CD34 ISC. So you can report epithelioid hemangioendothelioma. Now this is the last one of this series of skeletal muscle, peripheral nerve, and vascular tumor, angiosarcoma. Adults and elderly, and most common location is skin, soft tissue, breast, bone, and liver and spleen. Yes, I have reported 2 or 3 cases of breast angiosarcoma. It was difficult to report because I have to re-gross 2 or 3 times. All the time I did grossing 4 or 5 sections, always give hemorrhage, necrosis. Lastly, then I reported as a angiosarcoma and advised for a ISC. And it has got predisposing factor, previous irradiations, foreign body. If there is foreign body in the body, then they can lead to this angiosarcoma, AV fistula, or any pre-existing benign tumor. And that particular breast case, I have to ask 2-3 times, because whenever you receive a sample, the attendant will not be interested in a good reporting. What they are interested in is fast reporting. मुझे रिपोर्ट चाहिए. रिपोर्ट पैथोलॉजिस्ट तो यार 2 दिन में बना के दे देगा, उसमें कोई दिक्कत नहीं है, बट अच्छी रिपोर्ट होनी चाहिए. लाइक दिस इज they are suggestive of this could correlate, you can do EIC. That is not a report. Make a diagnosis, talk to the clinician or the consultant. You must talk to the consultant. This is the problem I am getting of this case. Give me some time. Most of the consultant will give your time. Because in the private practice, in the government medical college, I think very few consultants are now giving so much time on this filling of this form. Most of the time, their compounders are filling the form, their juniors are filling the form. Just tissue from thigh. अरे भाई टिश्यू फ्रॉम थाई कितने दिनों से है क्या है समटाइम एज भी नहीं लेकर आता इट इज वेरी डिफिकल्ट तो मस्ट एज द डॉक्टर मंडल सेड मस्ट talk to the clinician, must ask the radiological finding. It is grossly highly hemorrhagic. Yes, it is highly hemorrhagic. You have to you have to fix the tissue 2-3 days. You fix 2 days, then you take section with a sharp blade, the new blade, so that it will cut a good section. Or take multiple sections. Then in one of the section you will see this cells well differentiated as benign, very pleomorphic morphology. It will be well differentiated as benign, or it is will be undifferentiated as other sarcoma. And you will see this freshly anastomosing vascular channels, atypical endothelial cells, lymphocyte, and hemocyte rings. Endothelial cells variations you will get elongated plum of epithelioid. There will be a small or giant multinucleation also you will get. And IC will depend on the degree of the differentiation. CD33 or ERG is the most reliable ISC. So essential and desirable diagnostic criteria for this angiosarcoma is vasomorphoformative sheet-like growth, multi-layering of endothelial cell, nuclear atypia, increased mitosis, necrosis, and this positivity. I think this morphology is quite leading for this morphological diagnosis of angiosarcoma. Vasomorphoid sheet-like growth, nuclear atypia, increased mitosis. Yes, think of angiosarcoma with the history, with the location. And if your institute are not doing the ISC, then you can advise this ISC for this oncology center. See, this is a picture. This is the gross, this is tumor, this is the femur, this is the soft tissue here. And see this channels, vasoformative channel interconnecting with each other and this atypical endothelial cells. So this is all about the how to diagnose, how to approach the skeletal muscle, nerve, or vascular lesion. This is the last slide. We went to the Ghosi additional PSC, where my one of friend is there, superintendent. There is a paramedical institute. We did a paramedical. We did a cancer awareness program, poster presentation over there. This young paramedics are very important. These are the also very important role in our diagnostic pathology. We can think not for a lab or department. We can think of entire our environment, because once they took admission as a paramedic, in the village they will be labeled as doctor sahab, because वो medical college में है. तो इन लोगों को भी ट्रेन करना बहुत जरूरी है कि भाई ट्यूमर कब होगा, when they should refer to the higher center for diagnosis. This is Akshay. I started letting them to present or all PGs awareness. This is Akshay was presenting there. This is Sneha. Sneha is here, I think. This is my photo. This is poster presentation. They made a beautiful poster about the cancer prevention. This is, I think, this girl, paramedic girl, was receiving first prize or second. This is also a Sneha. Prayas is there. Thank you. Thank you very much. I hope I have finished on time.
Thank you, Dr. Dilip sir, for giving a very nice and precise lecture on the skeletal muscle. I hope the PG students have must enjoyed a lot and absorbed a lot from you. Now the house is open for any question.
Not audible.
And thank you for your very precise, Dr. Dilip sir. We enjoyed it a lot and hope the PG student might have obtained a great knowledge from your lecture. Now the house is open for any question. Thank you.
Yes.
हेलो, थैंक यू दिलीप जी
Thank you.
फॉर योर नाइस प्रेजेंटेशन। दो बातें आपने बताई पीजी के लिए, हिस्टोपैथोलॉजी से पहले हिस्टोलॉजी जान लो, और एक ग्रॉसिंग बहुत इम्पोर्टेंट है। तो ये दोनों बातें पीजी के लिए बहुत इम्पोर्टेंट।
Yes, you are quite right.
और हमारे पीजी जो है ये लोग करते नहीं, सीधे स्लाइड लेके बस क्रॉसिंग का तो कोई मतलब नहीं। हम एक पीजी का बात नहीं कर रहे हैं, हर जगह यही होता है। तो ये दोनों बहुत ज़रूरी है। आपने सॉफ्ट टिश्यू ट्यूमर तो लगता है कि अनंत है,
Yes, that is a vast topic.
लेकिन जिस सिंप्लिसिटी से आपने बताई बातें, काफ़ी अच्छा था, काफ़ी अच्छा लगा।
All the HOD of the medical college who are here, I would like to suggest make a slide box of normal tissue. If there your department has a forensic medicine, FMT, and you go and ask the forensic medicine, take a normal tissue from each organ and make a slide box of normal spleen, normal heart, normal kidney. They start with the MD pathology, this is normal. In AIMS, that was a routine. You have to issued a box of normal histology, you see in the orientation program. Unless until you see this normal histology, you cannot diagnose the pathology. You rightly said, and grossing, you must do the reporting consultant, must see the grossing. Your half of the burden will be cleared in half of the cases if you see yourself grossing.